Hello, I'm Russ McLEAN, Chair of the Patient Voices Group. Now, one of the many great changes to take place at the East Lancashire Hospitals Trust over the past year has been the appointment of a new Chief Executive. I was very honoured to have been involved with this process and happy to report that my first choice of candidate was duly appointed. Kevin McGEE is the Chief Executive at East Lancashire Hospitals Trust, or ELHT, with 5 hospitals under his wing and 7,500 staff. At my last meeting with Kevin, I began by asking him how long he's been in post.
Just on 7 months, and it's been a very busy period, but it's been a really fun time as well.
Okay, so tell the patients exactly where you're from. I believe you're a family man too.
Yeah. So my home is in Warrington, and I have 4 children ranging from 13 up to 23. So quite well spread in terms of the ages. My background is I've worked in the NHS now for over 30 years. I've worked in acute organisations up and down the country. I've also worked in commissioning, but primarily in large acute hospitals. Finance man by background, although I've done operations director and chief operating officers in large acute hospitals as well.
Obviously, it would be very remiss of me not to mention the fact that you came to a hospital that was in trouble, that had just come out of special measures. Thankfully, we are out of special measures now. How has that impacted on your job?
Well, what I see across the services that we provide, I see some really great services. I see some brilliant staff, and it really is an honour and a privilege to be the Chief Executive of East Lancs Hospitals Trust. I think there are some areas where we need to improve, and we recognise that, and we've done a lot of work in terms of putting additional frontline doctors and nurses onto the wards and departments, and we still don't get everything right. But I think vastly we have improved, and the vast majority of services that we provide are of a very high quality and standard. One of the things I would say is, though, that we are under a lot of pressure, particularly through accidents and emergency and if like the emergency pathway. So we have, between 500 to 600 patients on a daily basis coming through our emergency care pathways, and that's an awful lot of patients, and it's increasing as well. So we've had to open additional wards and additional beds. Sometimes we've had to staff those wards and beds by agency staff, and that has put pressure into the organisation.
So tell me about accident and emergency, because patients like me read in the newspapers and hear in the media all the time about pressures on A&E. Is it still the case that people are unfortunately turning up to A&E unnecessarily?
Whoever turns up in our A&E department, we have an obligation to treat, and we will always do that. So that goes without saying. The vast majority of the patients who turn up in A&E do need to be there. But we still do get some instances where patients may have been better either going through to their GPs or even going through to pharmacists for their care and their treatment and the advice that they need. So what we'd always do is to ask patients to think very, very carefully about whether they need to be in their A&E department and whether there is other options for them.
So tell me about you when you're enjoying and relaxing. What do you do to wind down? Because obviously it's a very high pressure job. What do you do in your spare time?
Well, we have 2 small dogs, so the dogs take a lot of time and energy in terms of walking them and looking after them. I'm also a great sports fan, so I follow all sports of all disciplines, watching and playing. So I do a lot of running, but I also like playing football and going to the gym. So the normal things, really. I quite enjoy a pint and going to the pitches at the set as well. So it's just normal family life, the same as most people do.
Back to the hospital, there are 7,500 staff here. Are you taking more staff on? That seems to be the indication that more staff are being taken on at the moment.
So this year we will have spent probably in the region around about £24 million on the use of agency and bank staff. And that's because we've had to open additional capacity because of the pressures that we've had through A&E in the emergency pathway, and because there's a national shortage of doctors and nurses. So what we're trying to do is to take on more staff on a permanent basis, that they then become our staff and we can train them appropriately in our ways, and therefore we can reduce the bank and agency staff. That will reduce overall costs of the organisation, but it will also improve quality.
And again, we read in the press and hear in the broadcast media all the time about locum doctors and the fees that they charge. Is that something over which you have absolutely no control?
We have some control in that clearly it's our choice about whether we employ the locum doctors or not. But if we're in the middle of January, it's a Friday night and we've got a gap in the rota on A&E or one of our wards, we will always make the decision to employ a locum doctor if we need it to cover the gaps in the rota to keep the system safe. So our number one priority is about safe, efficient care. Costs then come after that.
Now, I've recently been asked to be a judge at East Lancs Hospital Trust Star Awards, which celebrates some of the wonderful staff that you have at the Trust. How pleased are you that is the case, that we are now able to celebrate the staff?
I'm absolutely delighted, because what I'm absolutely certain of, and I know with every fibre of my being, is that we need to support staff and engage with staff and cherish our staff, because if we do that, they will be more motivated, they will be more engaged, and patient care and patient delivery will be better. So staff are our number one asset.
Now, you said when I first met you, in fact, a number of months ago now, that you were very patient-focused. Could you sort of explain how that manifests itself?
We will always put patient safety first. We will always put patient experience first. So what we've done, we've invested in more frontline doctors and nurses, even though we've got a financial challenge and we need to be very careful on the resources. But we will always prioritise patient safety and patient experience. And we're always looking at ways in which we can improve services. Patient feedback is really vital to us, because patients are our customers and we need to respond to what they're telling us. So when they tell us things are good, that's great, but when they tell us things have not been as good as they should be, and either their treatment is not being great or their experience is not being great, we need to know about that so we can put things right. So being patient focused to me is about responding to what patients are telling us and what their needs are.
And talking about patients and particularly complaints, one of the things that was highlighted, of course, in the special measures, because of the special measures, was complaints handling. How has that improved?
There's a number of ways we've improved. A very simplistic measure, we now have far less complaints outstanding. So we deal with complaints much quicker. We try and get resolution to the complaints. But what we also do is we try and get local resolution to complaints now. So rather than people always having to go through the very formal route, if we are aware that a patient or the patient's relatives are unhappy with care whilst they're in our hospital facilities, we will always have somebody available, senior, clinically, to talk to patients, to talk to their families, to try and resolve the issues immediately so that they don't go through the complaints process. If they then go through the complaints process, we try and respond very openly, very honestly, and in a really timely manner.
There are a number of initiatives going on throughout the Trust. In fact, the Patient Voices Group is helping you with a couple of them. The patient-led assessments of the care environment, where patients can go and look at the cleanliness of hospitals, and you have 5 in this area. And of course, you're changing menus at the moment, which we're very happy to be involved in. But what other innovative things do you have in the pipeline? Because I know there's an awful lot going on at the moment.
No, there's lots of things going on. So we're looking at, so without getting too technical, we're looking at the emergency pathway and our medical assessment unit. We're looking to completely revamp how that works. There's a department called ambulatory care. This is where people can come in and they, rather than go into a bed, but if they need some diagnostic tests and some treatment, but they don't need an actual bed, they can go into the ambulatory care unit. That's being revamped and upgraded. So I think right the way across the organisation, I think in every aspect of what we do, we're looking to improve and to become more efficient and effective in what we do. Healthcare is continually changing. So if you look at healthcare now, it's completely different to how it was delivered 10 years ago. And every year it will change. And what we've got to do is be on our toes and respond to that and make sure we are changing. So new technology, for instance, there's going to be lots of new technology coming into the organisation. New drugs, trying to provide care closer to home in people's own homes or in community settings. We've got to think about all of this and how we do our business.
Of course, you, as recently as last evening, had a fire on one of the wards. Are you able to share a little bit more information about that?
So we had a fire on a small fire on one of our wards. It was C14. The ward was evacuated overnight. It's now partially reopened. What I would say is that the staff and the patients were magnificent. So everybody was moved to a safe location very quickly and very swiftly. Staff acted immensely professionally, and the patients were brilliant in terms of allowing us to work with them to move them safely and quickly. So it was all handled really well. Our internal procedures kicked in, and it was testimony to the professionalism of the staff.
Kevin McGEE, Chief Exec at East Lancs Hospital Trust, thanks for talking to us and hope to talk to you soon.
Thank you.